midday.
Plus, any tooth injury is painful, but do you know what to do or not to do in the case of a dental emergency? Our own Amanda Sanchez gets expert advice from a dentist.
Welcome back, everyone. My guest today is Dr. James Mattingly. He's a dentist, and he's here to talk about when the dentist is your best friend. We're talking about dental emergencies, and you know that if something happens to your tooth and you're in major pain, you can't get to a dentist right away. Some people even show up in the ER. So welcome, Dr. James.
Thank you for having me.
So what happens if somebody goes to the ER? Obviously, we don't have dentists at the ER.
Yeah, the American Dental Association estimates that there are over 2 million dental-related visits to the ER every year. And the vast majority of those, unfortunately, do not get adequately treated. So we're talking today about dental emergencies and how important it is that patients see a dentist.
Okay, so a dental emergency, it could be a toothache, a chipped tooth, something wedged between the teeth, a lost filling or a crown, a vulsed or lost tooth due to some kind of trauma. And you recently brought up an example about Tiger Woods.
Right. I mean, dental emergencies can happen to anyone at any time. Tiger Woods, here he is at a golfing event, and he gets hit in the mouth by a TV cameraman's camera and shears off his front tooth at the gum line. Breaks it completely off.
Gotta be so painful.
I can promise you, when that happened, the dentist was Tiger's best friend.
Absolutely. You have a fast formula. First of all, F, you say, obviously, find a dentist. But what if you can't get to one right away? Call
your dentist if you have one immediately first. If you can't, go on to Google. There are dentists usually close by, no matter where we live. Go to any dentist before you're going to the ER. Make that your last resort.
Okay, Advil. You say Advil, not Tylenol. Why is that?
So the A portion of our fast formula is either Advil or Aleve. These are forms of ibuprofen.
Sure.
They help with pain and with inflammation. Tylenol helps with pain but does nothing to help inflammation.
Okay, so you want to use the anti-inflammatories if possible. Swelling. What do you do to bring down swelling right away?
Okay.
How to minimize?
We want cold on the area. Either get one of these cold packs that you can break, put against your cheek, or an ice pack. Stay away from heat. Cold is our friend.
Okay, and the last is T for tooth. Explain why we're talking about the tooth.
Okay, so this is an important one. Sometimes due to trauma, the entire tooth can get avulsed from the mouth. Okay? What we want to do in that situation is pick the tooth up by the crown of the tooth, not by the root.
Okay.
We want to keep the root as disinfected as we can. If possible, we want the patient to put that tooth, reinsert it back into its place gently.
Doesn't this sound lovely?
I know that freaks people out.
Right.
But if you can, that's what we want you to do. If you can't, or you're just afraid to, put it in a bag, a Ziploc bag with some milk or some water and a pinch of salt, and get to your dentist. Because what we find statistically, if we can get that tooth reinserted within 30 minutes, there's a really high likelihood that it will reattach to the bone.
Okay, but that's great advice, but here's the thing. If you can't get there in 30 minutes, which sometimes isn't going to be possible, when you're putting it in that Ziploc bag with the milk in it with a touch of salt, what's that doing?
Well, it's giving it just a nice basic solution to keep the tooth as close as it can to its natural environment.
Good idea.
And so that's the goal. But if you can, I know it's gross, put it back in there and then go see the dentist.
All right, perfect.
And if that happens, I promise, if you follow those guidelines, my fast formula, the dentist will be your best friend.
I can see why your patients like you. All right, Dr. James Mattingly with some good sound advice that hopefully none of us have to use, but if you do in a pinch, you know about his fast formula. Thanks so much for your time.
Anytime.
And stay with us. We'll be right back.